Hi everyone, Dr. Hadid here in Beverly Hills, California, and a question that we get asked by a lot of our out-of-state patients is how long they need to be in town for their surgical procedure. And the answer is it depends on how long they need to fly in to see us, because if they have a shorter flight, we typically want them to be in town 2 days prior to their surgical procedure. But if they have a longer flight, anything over 3 hours, we do want them to come into town at least 4 days before their surgical procedure. And the reason for that is to minimize the risk of developing blood clots in your legs, or DVT, which stands for deep venous thrombosis, which is when a blood clot can form in your legs and potentially be fatal if it were to break off and travel up to your heart and lungs, blocking off the circulation. So being on an airplane puts everybody at risk for developing DVT. This is why they always recommend when you're on an airplane or when you're sitting in a car for a long period of time, get up and walk around and move your ankles to keep the circulation going. So for shorter flights under 3 hours, we want our patients to be in town 2 days prior to surgery, and for anything over 3 hours, we want you to be in town 4 days prior to surgery. And then as far as how long to stay in town after surgery, it will depend on your surgical procedure, but usually we do recommend staying in town for about 1 week after your surgical procedure. That way I can see you in the office once or twice after your surgical procedure, but it also is a safe time to fly back home.